adaptive sports and recreational activities in order for us to stay healthy. I met my good friend, Dr. Max, who's going to be introducing herself. How long has it been? 3 years, Dr. Max, that we've been serving on the board of the Center for Independent Living?
About that much, yeah.
It's been a pleasure, man. So we have been talking about putting a Zoom series together for quite some time. And what do you know? COVID-19 hits us. And the need for people to have information and resources really just came on us. So we want to make sure that that we can provide you with some information. We're going to go for the next 30 days, Monday through Friday at 7 p.m. You're going to catch us right here on the Zoom channel that we're going to send out to everybody. And we hope that you will take the time to join us and learn a few things and learn something about yourself as well as about what's going on with COVID-19. We've invited a really good guest speaker, Dr. Adewale, and I'm sure I messed that totally up. He's an emergency room doctor. He's going to share a little bit about his story and what he's going to be speaking about tonight. But I want to come across, and when I was talking to Dr. Max, I want to come across to give this information, not just to people with disabilities, but also to people that don't have disabilities. So we're trying to really make it an inclusive message about how do we get through this time period, both on a physical sense, a mental sense, an emotional and spiritual sense for yourself and for the people around you. So I know there's probably a lot of stress, a lot of anxieties going on. So I'm going to share the mic now with my co-workers. We have Jean Ann is going to be our moderator for tonight. It's good to see Karen. Karen, good to see you tonight. All right. So I really do appreciate you guys coming on as you guys come on and join the conversation. Dr. Mack, would you like to introduce yourself?
Well, yeah. So I'm Dr. Maxine Ruddock. I like to be called Dr. Max. It just makes me feel a lot more relaxed. And as Hector said, we met when we both started serving on the board for the Center for Independent Living, and we recognized that we were kindred spirits, and so we both have a heart for servicing. And one of the things when Hector approached me and he said, maybe we should collaborate on something. What's in your heart? And my response to him was accessibility for everyone. We as human beings tend to find so many things to separate ourselves from each other. And so anything that I was going to collaborate on, I wanted to ensure that it was available to people regardless of disabilities, creed, culture, race. It doesn't matter. I just want to make sure the services were there. So a little bit about myself. I am a clinical psychologist. I practice here in Central Florida, and I'm also the clinical director for comprehensive psych and assessment services. And I have a heart for service. And one of the things that Hector and I talked about, and Gina and also, is we wanted to approach this from a very human perspective. We didn't want to, even though we do have our clinical skill sets and our training, we also wanted to acknowledge the fact that we're still human beings and that we are also being impacted by COVID-19. And so we wanted to have a journey where we invite people to walk alongside us, and to share and to be vulnerable and to open up a trusting space that's full of information and tips and techniques for helping you to manage anxiety, depression, and whatever else shows up for us. So we're new at this. We invite feedback from you. Be gentle. And so we're going to continue. We figure in 30 days we're going to be pros at this. But for today, we're all walking together. And so my thing is welcome everyone.
Hi, good evening, everyone. My name is Jean Ann Moses. I'm a clinical mental health intern. I actually work for Comprehensive Psychological and Assessment Services, and Dr. Max happens to be my supervisor. This is a change of life job, but I'm in the right position in the right time of life. Could have asked for a better time to be in this field, being able to just minister to people in every area of their life, right? I love it. I was in finance. I could minister to them that way. But this part about their soul and their mind, their body, it just makes me feel so awesome to be a partner with clients to help them go to the next phase in their lives. So is there anything else, Dr. Max?
Well, we said that we were actually going to, because it seems like, Hector, you like talking about yourself for a minute there, and I don't like talking about myself. So him and Gina were ganging up on me when we were practicing, and they said that they were going to reveal everything about me or force me to talk. And so one of the things that I said was we would just ask each other questions, kind of help each other to get comfortable in this process. So Hector, why don't you tell me, I'm going to come back to you, Gina, but Hector, why don't you tell me a little bit, tell us a little bit more about how you came to be such an advocate for individuals struggling with disability? Well, not
Sure.
struggling, but who have disabilities.
Right now, then we have to go back quite some time, right? We got to go back about 37 years.
All right, give it like 5 minutes, Hector.
There you go. I was back about 37 years when I was 17 years old. I was living in Dover, New Jersey, about 45 minutes from New York City. And I was just living in a very poor area of Dover. It was a small town. It's a beautiful town today. It was a beautiful town back then. But I was 17 years old and I was just making a lot of wrong choices. And that wrong choice, just that one wrong choice, cost me pretty much my whole physical ability from the chest down. So I am a quadriplegic. All right, I'll try to move back from the camera, but I have limited use of my arms and I'm paralyzed from the chest down with 75% of paralysis from the chest down that, as far as loss of sensation. But I do move my arms. Sometimes people think I'm a paraplegic, but I'm not. And so I had this car accident where I ended up hitting 2 cars and a brick wall, and it left me paralyzed from the chest down. And so about 6 months into rehab, Channel 2 News was doing an interview, and they were interviewing people for drinking and driving. This was just when Mothers Against Drunk Drivers was coming out, Students Against Drunk Drivers were coming out, and I was interviewed by Channel 2 News. And from that one news interview, I started getting calls. I started getting calls from churches. I started getting calls from schools, just wanting me to share my story, hoping that that would prevent somebody else from becoming paralyzed, or worse yet, killing somebody else. Because that's exactly what was happening in the 80s, is that a lot of drunk drivers were ending up killing people, and they were surviving. I, on the other hand, in my story, I ended up killing no one, thank God. But I did cause my own paralysis because I was drunk. I had a 0.20 blood alcohol level. I was severely intoxicated, and I spent about 6 months in rehab. Now, in that experience in being paralyzed in rehab, I didn't want to be considered disabled. So it took me almost 10 years, and I shared this with Dr. Mack, it took me almost about 10 years to really wake up to the reality of what now. And one of the men that I want to just talk about briefly was Norman Wright, who was my RN case manager. And this gentleman, man, he just kept coming and coming to visit me, because his job was trying to get me not so much on my feet physically, but get me on my feet mentally and emotionally on what I was going to do next in life, being paralyzed from the chest down. And he saw that interview and he thought that, hey, Hector, why not go out and start sharing your story and become a public speaker? And I started doing that, and I started doing a lot of schools, and I started meeting some really interesting people. In 1985, I helped raise the drinking age with President Reagan. Okay, and he asked me, he also saw me at my graduation. He called me at my graduation. Of course, I got one of those phone calls where I thought it was a cousin, playing a joke on me, but it was not, all right? It was really the White House calling for me, and just the president came on briefly just to congratulate me on my graduation. And then we had a relationship there almost for about 3 or 4 years, 3 years, about in 1985, where he invited me to share the stage and also to help raise awareness. And so I started working for New Jersey Highway Safety. I did that for several years. And about 10 years after that, like I said, when I woke up, what is it that I want to do with my life? And so I started getting a lot of education on substance abuse. And I'll talk more about that because, we have to go back 37 years, but that's exactly why I became an advocate back then for people, not so much for people with disabilities, but to try to bring some awareness to a healthier living and a healthier life. Why I myself was struggling, trying to do the same thing. So, and we'll talk more about that later, but speed up to about 2005, I went to UCF, the University of Central Florida. I got my master's in social work, and I did something with my life. And I started changing things. I started changing my own mind. And a lot of people said, hey, wow, man, how did you do that? So people started asking me, how did I do that? And I'm telling you, man, for me, it was a simple book by Eckhart Tolle. It was called The Power of Now. And that's what I learned to do. I had to learn how to live in the moment. I had to really just take a moment, smell what I was smelling, taste what I was tasting, hear what I was hearing, and truly just be at peace in that moment. Because tell you, in that moment, there was nothing wrong. There was nothing wrong. I was at peace, and it didn't feel like there was any paralysis or anything. So I practiced a lot of meditation. It brought me a lot of peace. It brought me a lot of serenity. And I started meeting other people with disabilities. And that's when I started welcoming myself, or at least inviting myself into the disability community. But that's enough about me, Dr. Max. Continue to ask the questions as you like. I'm an open book. I'll share on all topics, all right? And it doesn't have to be disability issues, because one of the focus here is I want to try to educate the able-bodied world too, in regards to how to deal with someone with a disability, or talk to a lot of the caregivers out there that are caring for their parents and not being able to be at the hospital with their parents right now at this critical time. So there's a lot of things that that I want to share in the next 30 days, and I love the fact that we have 30 days to do that.
Right. All right. Well, thank you, Hector. That was
know.
really, really, really good information. Oh, thank you. I like the story of the resilience and the hope, because again, it's going to be very relevant to what we're trying to do right now. Because of course, with all the difficulties and all the changes that we're experiencing as a result of COVID-19, you know, people are struggling with a lot of different issues. Some of them mental, physical, spiritual, and so that's one of the reasons that kind of brought Hector and I together to try to get this done. So thank you for even weaving that thread of hope and resilience through the story.
Thank you.
And Miss Jean Ann Moses, you guys don't get to interview me, okay? So Jean Ann, the only reason I actually had you go after Hector is because it would just, then I want you to just go segue into introducing Dr. Adewale, okay? So tell us a little bit more of the personal side of Jean Ann. Like, who is Jean Ann and what brought Jean Ann to the table where it was important for you to also tie into our message of hope and resilience?
This has been a year. You know, I've been back to school. I graduated, went back later in life after I'd raised my children. My husband and I have 2 children and a grandson and a daughter-in-law. And after 30 years, I went back to school. I after 30 years, finished my degree. And then it's always been my heart, even when I was in the field, in the financial field. I always did that with clients. I always nurtured them spiritually, physically. Dr. Adewale would attest to my style. And that's just who I was. And so this was natural for me. It was just who I am. And because I see the person, and it's more than just a dis-ease, meaning the mental illness. There's something deeper inside, and it's a soul condition. And I think when you look at the person as more than just the surface, and you see the soul that's like you will have a lot more empathy and sympathy and understand the why of their behaviors. Because we're not that different from each other as much as we may think, right? You know, Shakespeare says all the world is a stage. We're all actors. And the reason we know each other is because we know what it looks like. We're all the same in that regard. But in the process, I love to heal and I love people. And as you know, I'm very empathetic. I want to save the world. I want everybody to be happy. You know, I want everybody to help each other. And this piece to me is especially what's going on right now, which is one of the reasons I was having with Dr. Adewale, was because we keep talking about the social distancing. And I think I am closer and more interactive with people now than we've been in a very long time. We're not just texting, we're all Zooming. My mother has dementia. My father just died in December. My mother has dementia. And yesterday it was Easter, right? So my son's in New York, my parents in New York. My daughter was over here, and my nephews, one is in Jersey and one is in Brooklyn. They're all at different parts. And the whole family was there for her to see. So we don't know if it's the last time, but this was the closest, it was the first time we've all done that. And it was like my brother's sons, it was like amazing. So we're not socially distant. I think we're closer. And I think that's important. And I think that's what was necessary. And that being said, but I'm going to say something. Dr. Max, what made you decide to do this before I go to Dr. Adewale?
Wow, she snuck it in, Dr. Max.
I thought I had already put it out there
you didn't.
that was not going to happen for me. No. You know, I come at this from being not a psychologist, but as a mother, right? So my son is in DC, and you know, one day I was sitting there, and though he's a very responsible young man, and he's graduating this year, and so it's kind of breaking my heart that COVID kind of shut him down from having this moment. And it really is not him, it's me. I want the moment. But you know, I just sat up one day, and I was unbelievably anxious. My son wasn't here, right? And COVID had taken away a sense of control that I thought I had in terms of being able to protect my child. I mean, there he was, and he's in another state. I can't necessarily get to him. He's a man, right? And that's how he defines himself. I define him as my child still. And so what I had to do is kind of look around and say, well, where's all the tips and techniques that you've always talked to your patients about and your clients? And how are you now going to, now that it's the mother and not the psychologist that's sitting up at 2 o'clock in the morning with palpitations, what are you going to do? So then what I did is I started pulling together those techniques, and I did the sense of the pros and cons, paid attention to the fact that he's a very prepared young man and that there's as much as he could do. And then I pulled on what was important to me, which was my faith. And so that actually is something that, hang on, my computer's trying to die on me. That's actually something, that's something that I have actually pulled on. And so, this is live. So yeah, my computer's trying to die, but I caught it. And so, we've been, even with the doing as a supervisor with my interns, we were having a supervisory session, and I recognized how anxious they were. And it again, the professional had to kind of be there, but the human being was the more important part, so that we can kind of hold each other together. And so what I was saying to them is, there's so many of us who are walking this. This is new. It has no respect for gender, race, age, culture. It has no respect. It's just impacting human beings. So why shouldn't we approach this as human beings? So that's why I'm here.
Thank you. Painless.
And now, Jean-Ann, you can go ahead and introduce our guest speaker, Dr. Adewale. Jean-Ann, you will do a much better job than Hector and I could.
So this is Dr. Adewale. I've known him for, gosh, over like 15, 16 years. Yes. It's like, oh my goodness. I met him many years ago, and he's been here with Florida. He was actually part of Florida Emergency Physicians Group, the emergency room people that, when you go to the emergency room at Advent Health, which was Old Florida Hospital. So he was at Florida East. And it was just a group that I knew, and we just became my husband actually met him first, and we just became really good friends. But it became more than that. We had a coworker one, and this is the thing that really solidified him to me. And we called, she had gotten sent to the emergency room from work, more mature woman. And the care he gave to her, and he didn't even know her, and the nurturing that he gave, and she's by herself, but she became like a mother. It was so different, because you don't see that in the emergency room. And it just shifted how you looked, and your respect changes for a doctor, and you see the care. My sister-in-law was very ill one time, very ill, and he got it taken care of. It was just the caring, to listen, like it was over the phone, just telling him something, just in a state of emergency, and was able to bring the calm, and he just has that heart. He travels, he's gone to Haiti and all over the world for disabled, for people who are ill and unfortunate. What is the Doctors Without Borders, right? Dr. Adewale, you do too?
I have my own organization that run medical missions.
And what do you do with that, Dr. Adewale? He's going to take
this around the world and do a lot of medical missions from Honduras to Africa to you name it. We've been around, kind of slowed down now. I just support other organizations doing it.
And so, and he also, so he has the years, he's the medical director now of the medical school. Look at that.
So basically, in a nutshell, thank you very much, Jean-Ann.
I know, I praise you too much. I talk about you
now, right?
What do you say?
Jean-Ann is like, it's a big sister to me. Harry Moses is a big brother to me, and we've cultivated that relationship over a couple of years. That we're one big family. I'm an emergency physician by trade. I've been doing this for almost 20 years now. I trained at Howard University in DC College of Medicine. I did my emergency medicine training in Pittsburgh, Pennsylvania at Allegheny General Hospital. And since then, I've been at Advent Health Orlando, used to be Florida Hospital. I work as an emergency physician. In addition to that, I wear several hats within the hospital. I co-run the emergency medicine residency program that we have young doctors aspiring to be ER doctors. At the same time, I do a lot of research for the emergency department. And I'm the medical director for the Center for Medical Simulation and Education at Advent Health East Orlando. In addition to that, I do a lot of other stuff with the medical staff in the hospital and actively involved. And my passion is to give my heart to people in need. And that's what I do. And I enjoy doing it, and I'll do that till I die. But at the same time, when you have this passion, it's also okay to check yourself, because everybody has some kind of limitations in terms of what your expectations really are. And on my last mission trip to Honduras, I had an epiphany. The sense that when I go on this mission, I sponsor most of the team that go with me. I pay 50% of their travel fees and accommodation out of my foundation. And on this particular trip, I had an epiphany. I realized that the amount of money I spent going down there and putting the team together, if I had given that money to an organization on the floor, on the ground in Honduras, they could do a lot more with that money than me being there for 2 weeks. So after that epiphany, I stopped going on medical missions. I sponsor medical missions. I support with my own money while I kind of help from a distance. Because I figured the money could better utilize than me spending that money flying down there for 2 weeks. So as this coronavirus stuff started, it became apparent to me that the information we're getting are not on point. And I have a quick disclaimer, I have nothing to disclose. And all the opinion that I share on this platform are mine and does not reflect Advent Health Orlando opinion. These are just my personal opinion from my experience and from my research. So as I sit back and listen to what they keep telling us, it concerns me. When I say concerns me is the inconsistency on the information that have been disseminated from the top down. Even the people that should know better. The fact that public policy is now embroiling political affiliation. And what happens with that then is the people that make decisions, even the scientists in the room, they start having that influence impact their opinion that they disseminate to the public. So when I realized that, I started looking for a platform to better educate people in terms of how do you protect yourself. So I did a couple of series on Facebook on how do I protect you, how do you protect yourself? And as I was doing my research, it became apparent to me that everything we're saying is all semantics. When they say this coronavirus, or we call COVID-19, what is COVID-19? Basically, it's coronavirus that was discovered in 2019. That's what that means. Coronavirus identified in 2019. That's what COVID-19 means, okay? But it belongs to a category of viruses that we call the SARS virus. And what happened is when you look at how these viruses are transmitted, and you look at what they're telling us, I got scared and got concerned. So they say it's droplet. And everybody says, okay, what is airborne, what is droplet? And that's where the confusion arises. What is airborne, what is droplet? So what I had to do is go back to basics and understand the concept of what an airborne pathogen is and what a droplet is. And I found out it's all semantics, because all these viruses have been transmitted mostly the same way. You will inhale them. You inhale the particles because they float in the air. So the difference between a droplet and airborne is like a disease like tuberculosis. When someone has tuberculosis, if they cough, the droplet particle that comes out from that cough that contains the tuberculosis that could infect you, the same concentration travels in the air for a long distance. So if I have tuberculosis right now and I cough, if you're 1 mile away, you can catch it because it stays in the air and just floats in the air. Unlike droplet infection, where the maximum mode of transmission in terms of traveling when you cough is about 6 feet. So what happens is when you cough, the particle drops to the ground. But before it hits the ground, it evaporates. So there'll be a lot of particles that flows in the air, get dispersed in the air. And what happens is they can go a long distance and they stay in the air for about 3 hours. So at the end of the day, you could still inhale those particles. So all these viruses, the modality of transmission is aerosol inhalation. So you're going to inhale them. So when they keep saying you don't need to wear a mask, mask is not good for you, I almost lost my mind. And the reason why we were doing that at that time, this is my opinion, is the fact that we knew we had mask shortages. So we do not want the public to panic buying masks so that there will not be enough for the healthcare providers. If you look at China, you look at England, you look at all other parts of the world that's experienced these viruses, everybody wear masks on the street. And our government is telling us, like, you don't need to wear masks. It doesn't protect you. It's only for the healthcare worker. Turn around 3 weeks later, what are they saying? Everybody needs to wear masks because it protects you. If they had said that a long time ago, do you know how many people that would have been protected by wearing masks? So that concerns me. So I put a couple of educational slides together that I'll be using to teach people as it relates to how you can protect yourself. And I'm trying to share this slide now. Let's see if this works. I'm doing share slide and PowerPoint. This is new technology to me. Can you see?
It's coming up.
Yeah, you're doing good. You're doing good.
Okay. So basically, I have my disclaimer here.
Well,
And
the
if you
screen
look
is
at this
blank,
slide
Dr.
right here,
Adewale. Your screen is blank.
it's blank.
Yeah, we're just seeing a white screen. Is that what everybody else is seeing? Am I the only
Yes,
one?
I have a blank screen as well.
Okay.
Oh, so how do I make this?
Did you hit share screen? Is that what you did?
I hit share and I do not see screen
It
here.
should be a shared screen at the bottom.
Share screen up to right. Share computer sound. Let's see. What about now?
I
Something's coming
see
up.
your name. It said you started screen sharing. So let's see if you move a slide or something.
There we go.
I see a
It's an
mountain
island.
now. I see the mountain top. Come on.
My screen now?
Yeah, we see the mountain, the island.
Can you see it?
I see, yeah.
Yes, yes.
Okay, very good. So that's my disclaimer right there. Have nothing to disclose. This is my own personal opinion.
Nope. All we see is a
Don't see the
mountain.
disclaimer.
You can't see it? Oh,
Nope, just the mountain.
okay. Yeah.
Oh, I see it now. It's smaller. No, I see your face. Yeah,
You
I
see
think
the
we
picture
see it
now?
now.
We're
I have audio here and mic test. Okay, so I'm not tech savvy, but I'm trying to get this to work.
Is that a video you're trying to share, Dr. Adewale? Is that
a
are you
video.
trying to share a video or a
PowerPoint
screen?
slide.
Is it a video? Click
There's a
video
pow-
and get it started because we can see your screen now.
It's a PowerPoint slide.
Okay.
Can you see my screen now?
We can see a microphone
Settings.
and the
You
sound
see your
check
settings
screen.
screen.
Yeah.
Interesting. And you can't see my slides.
No.
Just the mountain.
Okay, hold on for a second. I'm trying to figure this out. Let's go back here.
Not to worry. This is a learning curve for all of us.
Yes, it is.
Share. Okay. I see whiteboard. I see optimize share computer sound. Can you see my screen now?
Still
Nope.
the
All
island.
we see is the island.
Oh, lordy. You see the island?
Yes.
That's
Well,
the
it's a
back-
mountain actually.
Okay, let me blow this up to the full screen there. What about now?
It looks like two photos. No, still the mountain.
Nope.
Just the mountain. Okay. Whiteboard. PowerPoint. All right. So I do not know how to get this to work. It's not sharing. You can see
Dan, are you able to
desktop.
help out?
I have the PowerPoint open on my computer.
It's okay.
And-
So then you should be able to hit share screen.
Yeah, that's what I'm clicking share screen. But it's not sharing it.
Okay. All right.
So basically, as I was saying,
Let's do it without it. Now you're in the hot seat. Got to do it without it.
hot seat. So basically, let's just try to hypothesize that if you have a patient that has the disease, that has the coronavirus, and imagine somebody standing 3 feet in front of that person, and somebody else standing 6 feet from that person. So if the person that has the virus speaks, coughs, or sneezes, the person that's standing closer to them, like within 3 feet, what happened is that person would inhale huge amount of viral volume. And those are the persons that get really, really sick. With time though, that viral volume will disperse into the air. And eventually it's gonna get to the person that's standing 6 feet from that initial person that has the disease. So when that person does inhale the particle, when it gets to them, it's dispersed significantly into the air. So that what they inhale are very small particles. So that even if you get sick from those, it's like a 50-50 that you inhale something. And if you get sick from those, you're gonna have a very mild disease. Like you have the regular flu, body aches and sniffles, and you will be fine. You're not gonna die from it. But if you were closer to the person that has the disease and you inhale that viral load, that means the viral burden that's going into your lungs is significant. And those are the person that get really bad. And they get intubated, they go on the ventilator. And that's bad news. So as we talk about social distancing, I figure out that is a luxury and it's a privilege because not everybody has the capability to perform social distancing by virtue of social economical status and where they live. So if you live in a suburb area, you can have social distancing. But if you live in the city or where you have houses close together and a large proportion of population live in a small area, guess what? You cannot have social distancing. It's hard to do that. If you live in an apartment complex that has like a 500 units and someone has COVID and they're coughing in their apartment and it's going to the AC system, guess what? It could get to you. So it's like, these are the information we need to be letting people know that. And that's why it's important that we test, so we can identify those who have it and be able to, shall I say, separate them, protect them from getting others infected. And what's terrible about this virus is this. When you compare this virus to regular flu, actually the transmission rate for the regular flu is about 38%. But for the coronavirus, it's between 0.5 to 1%. Go figure. Why is that concerning? Regular flu, 38% transmission rate, but coronavirus between 0.5 to 1%. So why should we worry about this? The problem with that is this, though it's only 0.5 to 1% transmission rate, however, unlike the flu, if you get the flu, you know within 2 days that you got the flu, and you can take care of yourself. But this coronavirus, the problem is when you catch it, you don't even know you have it. You may not display symptoms for 11 days. And what happened is between the time you contacted the virus and the time you manifest symptoms, guess what? You were shedding the virus and you're spreading it to other people. Unlike the flu, when you know within 2 days, oh, I got the flu. You can take care of yourself. I know I'm contagious. I'm going to isolate myself from my family so I don't get them sick. But this one, you cannot because you don't have symptoms for almost 11 days. That is the problem. So that is why this social distancing is very, very important in the sense that how we communicate or interact is going to change for a long time. Because why? We're not doing enough testing. So I do not know if you have it or not. So if I want to interact with you, I don't know what to do. Do I have you coming to my house? Do I stand by next to you on the street and start having a conversation with you? No. So we're going to go back to an age where you're standing 6 feet away from me and I'm yelling back at you because I don't want to be close to you, because knowing that if I'm within 6 feet away from you, even though you have the disease, chance of me getting infected is very slim. Even if I catch it, I'm not going to get really, really sick. Versus if I'm close to you and I catch it. So that is the problem. So that's why it's very important for us to maintain this safe social distancing. And I tell people, if you have to go to the grocery store, if you can find a mask, get a mask and wear it, because you don't know who has it. And if you walk down the aisle, maybe the person before you has the coronavirus and they cough, or they were speaking and they're shedding the viruses, but they did not know they had it. And you just walk by, you take a deep breath, you inhaled it. Guess what? You got coronavirus. So that's why if you have the mask on, it has as a barrier to protect you from inhaling the virus. Even if you do, the volume you inhale is so minimal that you're not going to get sick. And that's what we need to start telling people, that if you do that, you're going to keep yourself safe. You're going to protect yourself and protect your family. So that's why it's very, very important that social distancing is something we all have to embrace. I love you, that's why I'm staying away from you. My daughter just had a 9th birthday party. We have a drive-through birthday party where people drive by the driveway, hung their on, and drove by and sang happy birthday. We can't interact because you do not know who has it. So how do we protect ourselves is by maintaining that safe distance and making sure that when I go outside, I wear my mask. So I go to this store, I see people with gloves on. They use their gloves to push the cart. They use the glove to pick up the grocery from the aisle. But guess what? When they get to the cashier, they reach into their pocket with the same gloves. They grab their credit card with the same gloves and they put it back in their wallet. So guess what? They've cross-contaminated themselves. I'd rather have you go in there with your hand, pick your grocery. When you don't wash your hand and use your hand sanitizer, and you'll be fine. Chance of you cross-contaminating yourself is very minimal. So the goal is, if you maintain a safe distance and just perform just a routine, basic self-protection, hand washing, don't touch your face, and maintain social distancing or safe distance from whoever is next to you, you will be fine. Even if you get exposed to it, it's not going to kill you. That's why about 80 to 85% of people that contract coronavirus do not die from it. About 50% do die from it. And those are the ones that were exposed to a large volume or that have a significant comorbid factor, but at the same time, the viral load they inhale is so significant that it overwhelms their lungs.
Can I ask you a question? Someone was asking, will the virus enter through the eyes or other openings too?
So for that question, only people that are in very close proximity. So for me, in the emergency department right now, if I'm going to see a patient that's suspected of having coronavirus, I have to wear a hood or a face shield. The reason why that's important is every time we speak, phlegm comes out of our mouth, but we can't see it. How do I know this? I did an experiment where I wear glasses, but my glasses is for driving and for seeing far away. So one day I wore my glasses at work to see patients. And at the end of the day, I have so much speckles on my glasses. And I'm like, oh my God. So if I didn't have a barrier, whatever is coming out from the person's mouth is going to my eyes. So that's why if you maintain a very close contact with a person, then you worry about the eye, worry about any open tissue that it could be exposed to versus inhaling it. So the eye is more for people that are in close proximity. Like when I examine a patient, I have to look into their eyes, look into their nose, look into their mouth, listen to their lungs. I am in very close proximity. So for me, my eye is more concerning, not for the lay public, unless you're going to be standing face to face with the person. I think you're mute, Jen.
I know, because so you can talk. So here's the other question. A lot of people say it doesn't affect children, but we've heard of things happening to children.
Yeah, that is not true. It does affect children. The only good thing is, for some reason, they do not get really sick. And we've had a couple of children die, you know, and we've had young people, 17, 16 years on a ventilator, you know. It all depends on the volume of viral load that you inhale that will determine if you get really, really sick or not. But children do get it. For some reason, they happen to be resilient because they do not have any risk factor that we have. As we get older, our immune system is not the same anymore as a young child that has like a strong, healthy, vibrant immune system, So that's why they may get it, but they will not get sick as a grown-up that has an underlying medical condition. But never say never. There's always instances where kids will have it too.
Okay, and this one is for me. I've been watching Chris Cuomo, okay? And you hear these people talk on the news and the next thing like they're dead in 2 days. But he's been on the news every day since he's sick, but he says his body is racked like the people are saying they're doubled over. Do you know what I'm saying? Like, there seems to be so much confusion about what it feels like. The other day, my body was hurting. I'm like, do I have corona? You bend down, your knees hurt.
The problem with that is, unlike the flu, when you know the exact symptoms that you have, this coronavirus, it's like it manifests in different ways. Because I've had someone come in where they were at the grocery store, they were going to their car, they fell, and they broke their ankle. And unrelated. And you get a chest x-ray, you see a pneumonia. You say, why don't you have a pneumonia? You test for corona, positive. So you have someone come with nausea and vomiting and diarrhea, and they have corona. So we've seen people with different spectrum of manifestation. And everybody keeps saying fever, 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 fever. What we're seeing is only about 29% of the people that have corona has fever. About 41% will have like a just dry cough. So it's hard to tell. If you have it, you may think I just have allergies or I just have the flu, that's why I have the cough. But you probably have corona. So there's a lot of people walking around that's had corona and they've gotten better. But because we're not testing, it's hard to tell who's had it. And so the next frontier now, as it relates to testing, is antibodies. So soon you're going to start hearing about antibody testing, where they draw your blood and they can test your blood within an hour. We can tell if you've been exposed to coronavirus in the past or not. Though you don't have any symptoms, you probably have it and you didn't get sick, but your body has built immunity to coronavirus. So once we start doing more of this antibody testing, that will enable us to identify people in the community that already have it and they've gotten better. And why is that important? Because one of the new things we're beginning to do right now is to harvest the serum of a person that has coronavirus and that's gotten better. And after 2 weeks of being better and their tests are negative, we can actually get their serum. And the plasma they donate, we're actually seeing help in treating people that are very sick with coronavirus. So the more people that have antibodies to coronavirus that we know, the better we'll understand how we can care for these people by saying, hey, you have antibodies. Can we get your plasma so we can help that other person that has coronavirus that may be dying from it? So right now, without testing, it's hard to get to that. And guess what? This antibody testing costs about $10. So you're going to be hearing more about this in the next week or two, where we're going to try to see how we can make it more available, that people can get antibody testing to say, hey, I've had it before and I'm cool. I have immunity. Even if I get it, I'm not going to get sick because I already have antibodies to coronavirus. And that's the next frontier. That's why we keep saying before we try to open the businesses, let's do more tests, do antibody testing, have more understanding as to who has it, who doesn't have it, who's had it before, and they've been cured, and they didn't have any manifestation of the disease, and be able to say, okay, we're good now, we can go back to work. But without knowing that, without doing adequate testing, it's hard to tell. If you go back to work, your coworker might have it, and they don't even know they have it. And that's the problem. So we're worried about what we call the second wave that's going to be coming. Once the business opens, then we go back to what we used to do, and things are going to happen again. And that's the fear right now in the healthcare field.
Let me unmute. So Dr. Adewale, thank you so much for that information. I kind of want to bring us back to, that it was just a lot of information about the viral load in the air, and even just, because you can't see it and you're walking around with it. And so many of us were told way before not to wear masks, but now that they are saying that, and of course, not everyone has access to masks now. right? And
Yeah.
so what can we tell people who don't have the access to the mask and they still need to be able to get their necessities, their care, their food? I mean, what do we tell those people?
Find something. You know, any barrier is better than no barrier. So you have all these cloth masks out there now. It does not protect you 100%, but if I have a barrier, I'll take whatever I have. So let's say you have the cloth mask and you have two of them layered together. And as long as you maintain safe social distancing, like what I said before, unfortunately, I cannot show you the slides to see the image of what I'm talking about. What happens is by the time the viral particle disperses in the air, by the time it gets to you, they're so small and the volume is so low that chance of it going to your cloth mask, even if it goes through it, you're not going to get sick. Even if you get sick, you're going to have a very mild disease versus having a cloth mask and not maintaining a safe distance. And someone coughs in your face, guess what? 50% of the load is going to go through that mask and it go into you. So even with the barrier, it's still important to maintain a safe distance.
Okay. And Norman seems like he has a question. Go ahead,
Yeah,
Norman.
I
think you're
have a couple
unmuted.
of questions, and thank you very much. I'm an RN. I live in Las Vegas. My specialty is infection prevention, and I've been working in infection prevention. I've been a director of nursing and all. That's enough. And Hector and I know each other for many years. There's two things I want to say. One, if you want to make a N99 mask, if you have a HEPA vacuum cleaner bag, they're 99%. And N95 masks get you 95% of the particles. And a HEPA vacuum cleaner bag, if you want to use that, you cut it. It will be a much more effective device than just a plain cloth that you would use. Secondly, I was thinking about this, and it's an interesting question. If we get gradual little tiny doses of this thing, our bodies will be building up an immunity to this. And bottom line is, from what I'm understanding of what you're saying, is we don't want to get the big blast of it and have the viral load. But it would seem to me that eventually, through picking up a credit card, picking a dollar bill or whatever else like that, we're not going. It's impossible to avoid the viruses totally. But we will, as a society, be gradually building up immunities. I would think. Am I correct in that?
Yeah, you are correct. That's the phenomenon called herd immunity. And the more people are exposed to it that do not really get the real sickness, that they do not die from it, they will eventually develop antibodies to it. And those antibodies will help them say the next time they get exposed to it, I'm ready for you. And they'll be able to fight it off. And that is the hope, and that's the anticipation of what the future is going to be. I'm glad you talked about the credit card and the money. I think the way we, conduct transactions is about to change. Because most stores now don't want to take cash anymore. They don't want to handle it. The reason why is studies have shown that the virus stays on paper for about an hour to two, and on the plastic for about a day, on the plastic for about 3 days. So it's like the only way you can avoid getting sick by handling those is by the hand sanitizer. The funny thing is, I still consider those as a luxury because you have to buy them, and good luck trying to find them. So it's like if you carry hand sanitizer on you at all time and you do handle money or credit card, if you sanitize your hands, and you'll be fine. The funny thing is, most people touch their face more than 99 times in a day. So if you wash your hand and keep your hand clean, chances of you transmitting it to yourself will be very, very slim. But it is hard to do that consistently. And that's the problem. And not having the resource to do that.
All right. Does anyone else have questions? I got my eyes on the clock because we said we're going to do this for an hour. So, I want to make sure we're respectful of everyone's time. Does anyone else have any questions for our amazing Dr. Adewale, who's given us so much information? Norman, I see your hand. I'm going to unmute you.
Hector.
I'm sorry.
Yeah.
Never mind me.
It's,
It's
I know you
late.
always get confused between Norman and
It's
Hector. We
late.
look alike.
No, you don't.
So listen, Dr. Adewale, really good information that you put out there. And I thanks for Norman for that input, because what I'm seeing is a lot of anxieties, especially in my community, the disability community, people that neuropath disease. A lot of those people are really concerned. So I mean, right now, what I could do for myself is I am quarantined at my house, but I do have one roommate, or I have my nurses, and they're also quarantining themselves at their house. So should I conserve my energy, preserve my energy? Because, I still want to work out here at the house. I mean, do I still continue to live a normal life, as I was doing?
Absolutely, yes. You cannot let this prevent you from living your normal life. The most important thing, though, it's anyone that's going to be interacting with you, they got to have their mask on. And you have your mask on. Absolutely. So it's like, if we make masks available to everybody in the population, you can go to work as long as you have your mask on, because when you breathe, because what happened is they did a study from Italy that they looked at patients that have the coronavirus. They swabbed their phlegm, their mouth, and they swabbed their nose. And they found out that 15% have the coronavirus in their nose. So just breathing in and breathing out, you're shedding it. Then about 85% have the virus in their saliva. So when you speak, when you talk, whatever comes out has the virus in it. So you don't really have to cough or sneeze to shed it. So that's why it's important if someone has a mask on, even while they're talking to you, whatever is coming out or they're breathing out is contained within the virus, within the mask. So you're protecting yourself and they're protecting themselves from getting you sick. So my philosophy is, when I go outside, I'm going outside as though I have the disease. So I'm wearing my mask. So in case I have it and I happen to be one of those asymptomatic carrier that's not sick yet, I don't want to be shedding it. So that's the responsibility I put on myself, that I'm going to wear the mask everywhere I go outside of my house to make sure that just in case, by virtue of my job, if I get exposed to it and I don't have symptoms, I'm not going to the store and spreading the virus to other people. So by me wearing the mask, I'm not shedding it. If I'm talking to the cashier, whatever is coming from my mouth, if it has the virus, I'm not exposing them to it because the mask contains all those stuff. So that's why when you carry out your normal life, it's imperative that you say, you know what? My new norm is if you come around me, you have to have a mask on, period. You want to talk to me, you got to have a mask on. And stay 6 feet away from me, even with your mask on, just in case you cough. There's a video going on online from Japan where they use photoelectric camera, for imaging camera, to look at someone that sneezes with mask and without a mask. And you can see what comes out without a mask. I mean, you can see it lights up. But this person that has a mask, when they sneeze, nothing comes out. Even if something comes out, just small particle come out from the side of the mask. So by just having that mask alone, it's a barrier that protects you and protect the other person. And that's the way I see it.
You just mentioned Japan, and I made photos over there, and in Japan, they wear masks all the time. That really surprised me. I mean, you go on a train, and I don't know if you can see this here.
Yeah, see. Everybody has a mask.
Look, where are we there? Right there, the people on the train. And this was 2008 that I was there. And when I asked them, it's not everybody wears a mask and they don't wear it all the time, or at least they didn't back then in 2008. If they felt they had a tickle or they felt they were a little sick, they would put it on as a protection against other people so that they wouldn't pass it on to other people. And that's one of the main reasons why you want to make the mask is to keep anything, your saliva, your sneeze, you can go 20 feet there, 16 feet there sometimes, little tiny particles. And that's the mask prevents that from going. And you want to sneeze not in cough into your hand, you want it into the elbow. Big trick.
Exactly. Very good.
All right, so now I'm looking at the time. It is 7:55, and I know that Hector wants to talk a little bit about, we want to kind of get a little bit more focused on this information. Our goal is to provide individuals with information that's going to give them a sense of hope, a sense of control, a sense of knowledge and understanding so that we can protect ourselves and the ones that we love. And then also just to kind of talk about what we're going to be doing next, unless anyone else has questions and they want to continue. But we also just want to let people know that we have another show tomorrow. And so we can kind of segue into that. So, if no one else has any questions, or Dr. Adewale, if you don't have anything else, maybe we can do that.
Thank you very much for hosting this and giving the forum to people to kind of, get the real information as to what's going on. And unbiased, political affiliation, it's about the safety of the population. That's important to me, and what you see from experience and what you're hearing, for us to not come back 6 weeks later and say it's okay to wear masks now. That hurts, knowing that a lot of people would have been prevented from catching this disease if they had masks from end of January, not, end of March. It's okay to wear masks now. So that's painful. But it is what it is. Our goal is, let's protect ourselves and trying to get to normal life again.
So Dr. Adewale, with that 6 weeks later stuff that you said, if we needed to bring you back on in another 6 days or so, would you come back on?
Sure, Jane knows where to find me.
Let me also make the point that we have recorded this Zoom series. We're going to be recording every which one. There's actually 9 people right now in the room. If each of us would share this video with 3 or 4 of your friends, with 3 or 4 of your professionals, just start spreading it around. Let them know that we're at least having this discussion, and not just here in Central Florida. We're out there in Las Vegas having these discussions. We're all around the country, really, and that's what I would like to see. Tomorrow, we're going to have Jen Wolf on, who's a peer advocate, but she's going to talk a little bit about her work and how she's coping with this thing as far as being a person with a disability. And she's going to relate it to people both with disabilities and not disabilities. So I look forward to that. I look forward to Norman Wright coming on and joining us on Wednesday at 7 p.m. And he's going to talk a little bit about utilizing certain technology that you can use to track the COVID-19. So I'm excited, Dr. Max. I don't know about you, but I'm really, really excited. Jane, great job. I mean, it was kind of nerve-wracking there in the beginning, but we got our act together, and I really do appreciate you guys inviting me to be part of this. And Dr. Max, it's such a dream come true to actually be doing this in public and as professionals, to really just be out there and just putting out a simple message to just protect yourself, because in protecting yourself, you protect other people as well, So thank you. Thank you for this great group that got here today. Karen, good to see you.
Absolutely. Social distancing is important, guys. We recognize that we can't see the virus, so we just have to assume that it's there.
Hey guys, you can do a watch party on Facebook, because I actually have a watch party going on right now, and we have other people from all over the country on that one. So if you do this on a watch party, I'm going to share it on some other stuff, because this was we hear this stuff all the time, but you broke it down in a way I'd never heard it before.
Yes.
And so I really appreciate. Dr. Max had been saying this prior to it happened when we were under supervision, and you repeated verbatim what she said. So it's really, and this was back in January.
Mm-hmm.
This was back in January. She was saying that to us.
I don't think they're saying the truth.
That's what's so scary.
Yeah.
But, thank you, because you make it feel a lot less stressful, because you're aware of what to do. You got to be distant. We're still social, because we're socializing more than we ever had, right?
Yep.
Right. But now technology is allowing us to socialize while staying safe. So for now, the thing is, stay educated, stay empowered, and stay safe.
Yep.
Amazing. Thank you so
Stay away
much.
from me because I love you.
That's going to be our new post. Stay away from me because I love you.
Right?
See past cares, right?
All right. Thank you, everyone, for joining us, and we hope to see you guys tomorrow. We are going to have amazing, just down-to-earth people who will come on here with a heart for educating, empowering, and protecting. So hope to see you guys as we
same link for
series,
tomorrow.
Same link for the whole time. We'll just keep sending it out.
29 days to go.
Huh? Please feel free. to share, anybody you think you'd like to hear
Oh,
about.
and we also want to just remind you guys, if you know anyone who does want to come on and share some information, and if anyone here does also want to share some information, just kind of hit us up at the email address. Let us know what you want to talk about, what days you're available. Certainly, we'd love to encourage you. There's none of us walking ahead or behind. We're all walking through this together.
Amen.
Okay, thank
Amen.
you.
Good night, guys. Stay safe.
Good night, everyone.
Bye.
Night.
Bye. Thanks again, Dr. Adewale.
You're welcome. Thanks for having me. Be blessed, y'all.
You too.
Blessings.